Again, light of that lamp just there straight into the camera. Yeah, me again. Still waiting for that poo, that magical poo. Golden rainbow magical unicorn poo. Had a few of those sprinkly farts, but no poos yet. Moved on a little bit with body movement exercises. What I've started doing now is hand to the lower coccyx area. At the back there you've got a coccyx, curls over, curls under. Your back comes down and then tucks underneath the body. You come around there, you can feel it's like a fishtail almost. Okay, and if you come and rub gently on there, little circles on there, that then stimulates that area. So what you're looking for is activity that you can feel and feedback that you can feel. Both of those, it's stuff that's going both ways. Okay, you don't want your feet pushing onto dead stuff, as it were, feeling nothing, although that does help, because you're still trying to activate that into life. And the other way as well. So if you're making movement with stuff that's got movement there, then you're sort of enhancing that feedback, that connection between the mind, the body, and the part that you want and the bits that you want working again. Okay, you can move your hands slightly around this way, slightly around that way, and a gentle deep massage. Because when you think about it, basically it's your anus then goes up into the body, and that's it, that's the tube, comes all the way down. So if you massage it and you can get the feeling on that part there, all you've got to do is keep that feeling going all the way up, further and further and further until you're connected up until where's the problem at the moment. If you can get that moving around up there and helping to send the signals back down, that's even better. Okay, I've missed a couple. It's an ongoing thing. It's an ongoing thing. It's a thankless task, very repetitive. And if you're trying to do it without your meds, then it's not quite so easy there. I've tried to track my meds in as much as I can and talk to me actually about me using my meds, and I spoke to him about what it's doing to my head. And I think they were of the same opinion, they don't want that. Listen, drugs are drugs. You've got to use them for the best thing that you can at the time. We don't always think about that balance though. Is it better for one thing, or is it better for another? There's a chance I might med up again to get more mobile and forceful with some of the things I'm doing, knowing that it's going to affect me a bit, and knowing that it's a short and sharpish one, if you know what I mean. A day's worth and come off again. We'll see. I hope your journey's going well. Keep up the faith. At Bon Jovi, wasn't it, I think? Okay, I'll see you again soon. illicit poo. How would you believe that? Just going through on my phone. Wow. Mentally, the thing's there mentally. I'll be back in a minute. Okay. Hi folks. Yes, aren't we most civilised talking about poos and all this sort of thing, filming in the toilet. But that delirious moment arrived. It's about 2 now, I think. I'll have to do a time check on when it first arrived. About 10 minutes ago or something. But I turned it off because I realised that part of what was working, made it work, was the mental, psychological attitude as well. I was on my phone, my gallery. Before I came in, I'd done a set of column slides. My son. Various different exercises that I do. Using handheld weights and all sorts of stuff. Lifting your legs and whatever. I was going through that, and that was putting in my mind as I was going 1, 2, 3, and I was looking at them from the back to the front. So I had to sort of figure it, put my engage, because I didn't just follow them through. I tried to figure out what was the one I was following from the last movement. Excuse me. Last movement of the sequence. And all I did, for example, I had a curl. I started from there, right? And then I went halfway, full way. Excuse the me, I'm going for a poo. Now we're getting a bit more vocal down the back there. Anyway, it's putting my mind into gear, activating all these, maybe it's this, again, putting the mind into gear, not being this invalid that I am in hospital, but this person that was active, doing stuff. I was, at that time, I was performing very well. Cramps at the same time. So the next thing, the challenge we're going to have is, now we've started to have a poo, how do we stop? So at some point we've got to stop, go back to bed, go to sleep, have breakfast, get up, maybe then come out and have a wash and have a poo, or have it tomorrow, but we have to finish this sequence. So at the moment I've been sort of giving it time. I'm just letting it run its course. Just sort of empty as much as I can. So there isn't that much where it's gone out. That's what I'm aiming for. And then, if there's not much to come out, it'll be easier to keep it in, won't it? And so at the moment, quite a lot of it is diarrhea-ish as well. Oh, a little bit of a push there. You can hear, probably hear that diarrhea thing. Okay, so it's a bit like when you've flushed the pipes through. You've got bits of water there, and you've got bits of clumped together, and you've bits of all sorts until it's all clear and then working as a functional unit again with the stuff on coming in from one end as a first unit. So what I've almost got to try and do is get rid of all the bits that are along the pipeway. Because I don't know how much control there is there of keeping it back in at the moment either. So I don't really want to be laid in a poopy bed. But, yeah, once again, there's some of my experiences. Hopefully yours are going as well. You'll get there as well. And I do think it helped connected to connect via both ends of the scale. Gentle massage in the tummy, gentle massage through down around the coccyx area. And at the end, I was jiggling to almost not shake a bottle, but that sort of motion, using my toes and my hands, connection of my toes, elbow resting on my hand. I'll show you that. So my elbow's on the leg. Okay, so I can do this with my feet. Slow it down a little bit, so I can do that. Along the same time as I can do this, because that's moving my hand, and at the same time as I move my hand, I can do that at the same time. Then it's not all about my arm trying to move my body around the back there. So when I was massaging, and then I would do that, gentle shake it up. Gentle shake it up. Can I sort of then bring some of this pressure and what have you to bear to produce movement inside, and where there's those little bits of bits, liquidate more to make that passage. And thank the Lord, so far I think we've just about done that now. Okay, I'll catch you again soon with more updates.